Good morning. How are you?
I'm doing well. My name is Leona. I'll be your nurse today.
Okay.
And I'm going to be doing a physical assessment, a full physical assessment on there. We're checking from head to toe today.
Okay.
All right. And so I'm going to get started in just a moment. Let me wash my hands and
Okay.
give us some privacy, okay?
Okay.
All right. Let me verify your name and date of birth, please.
Okay. Megan Hilson, 82587.
Megan Hilton, 82587.
Mm-hmm.
Okay. All right. So, hopefully we can get things going here. Okay, Megan, I gotta do just a few questions for you. It's gonna sound really silly, but I'm asking you a few questions just to make sure you are with me today.
Yes, ma'am.
Okay, so you gave me your name and your date of birth. I wanna know what day it is.
It is February 24th, 2023 is Friday.
That's very good. And who's our president?
Joe Biden.
Okay, good deal. So she's oriented, she's responding to my commands, she's making verbal eye contact with me, and it looks like she's conscious with me. We would rate that with a Glasgow scale, most of that, but I'm also gonna be checking the movement later. Okay, so I am so irritated with this right here. I don't know how to get this to stay up today. So hopefully that will do it. Okay?
Okay.
So, do you know why you're here, Megan?
Yes, to get a physical head to toe assessment.
Okay, great. You still remember that. All
Yes.
right. So I've noticed also that she has good speech. She's dressed properly. There's no particular odor or anything. She's dressed appropriate for the season, and so she's good there as well. There's Megan. I'm going to be checking your head, be touching you in some areas today. This is part of the physical assessment.
Mhm.
And so just be understanding that it's okay that I touch you in these areas.
Yes.
Okay, good deal. So the first thing I'm gonna do is just touch your head.
Okay.
Okay, so I'm just checking for symmetry. I'm checking you for any lesions or anything that's dealing with symmetry, bumps, lumps, things like that.
Mm-hmm.
And so you haven't had any head injuries?
No.
Okay, good deal. And you have any pressure or tenderness here?
No.
Okay, what about here?
No.
Okay, what about here?
No.
Okay, good. And so I'm also noticing that you had any drainage with your nose. I know it's allergy season. Are you having any troubles there?
Just a little bit, but no swelling.
Okay, so at this point, I'm going to be looking at your eyes.
Okay.
I'm looking for, just to make sure that your eyes are constricting.
Okay.
And making sure that they're dilating the way they should.
Okay.
I'm also gonna check your ears and your nose, okay?
Okay.
So we'll take a look first. You just look straight ahead, like past me a little bit. Look up. Okay, she's about a 6. I'll check the other side. This looks good. All right. Are you having any blurred vision or anything?
No.
You seeing okay?
Yes.
You don't wear glasses, right?
Contacts.
You do?
Yes.
Okay, good deal. I'm gonna come in
Mhm.
on the side. This light's not gonna be too bright, but I'm gonna show it from the side, and I'm
Okay.
just looking for that constriction and that dilation, okay?
Okay.
Alright. Good. Good. Alright. Also, I'm gonna check for accommodation.
Mhm.
So I want you to look past me, like over behind me,
Okay.
and then when I tell you to, I want you to just focus on the pen.
Okay.
Okay, so look behind me first,
Mhm.
and then focus on the pen. Good, okay, all right. So I'm also gonna be checking, making sure you hear me properly. I'm gonna
Mhm.
give you a little code, and then you just repeat after me, okay?
Okay. AET.
Very good,
Okay.
all right. And have you had any drainage in your ears or anything?
No.
Okay, her ears look symmetry, they're looking good on both sides, no drainage or blood or anything coming out of the ear.
No.
Okay, and no ringing in your ear, anything like that? Okay, so I'm gonna have you look up and check the nose. You told me earlier that you didn't have any drainage and it looks good, pink. Mucosa looks good. Let me check your mouth,
Okay.
open up. I see you got your Invisalign in,
Mhm.
but your mucosa looks very good. Okay, gums are good. Have you had any trouble swallowing?
No.
Okay, good deal. Your color looks good for your complexion and the temperature is good. You don't feel too hot or too warm.
Okay.
Okay. And also, I'm going to do something here on your neck. I'm just going to pinch you a little bit. I want to make sure the skin just returns. It tells me if you're dehydrated, okay?
Probably.
But you're looking good, okay? That's called skin turgor, so we're just
Mhm.
making sure it's elastic and it pops back, okay?
Yes, ma'am.
You said you didn't have any head injuries?
No.
Okay. All right, so now we're gonna move on to, check, there's a vein in your neck, I just wanna check, I can do this
Okay.
later, but I'm gonna go ahead and do it now since I'm
Okay.
right here.
Sure.
I'm checking for jugular distension, making sure you don't have any swelling in this big, jugular vein on the side, and I'll check both sides, and you look very good, okay?
Okay.
Now, Megan, I'm gonna get started on, some neurological things. We've already kind of tested some of the things I told you before, like seeing if you're oriented.
Mhm.
But I'm gonna check for a few more things just to look at, okay?
Okay.
So, actually, you look good. I actually checked everything. I thought I had missed something, but now we're gonna go to respiratory, okay?
Okay.
So here I'm gonna check for, first I'll start off with your pulse.
Okay.
I'll check the radial pulse. I also check the carotid artery here. This will be another pulse, and then I'm gonna check her radial pulse, but I'll just do one assessment, okay?
Okay.
And we'll get started in just a minute. Okay, you're at 35, which that means we're gonna double that, and your pulse will be about 70, which is a normal range, okay?
Okay.
All right. Now I'm gonna get started and listen to some breath sounds for you.
Okay.
I'll be checking your lungs.
Okay.
So you just breathe normal.
Okay.
When my stethoscope touch you, just breathe in and out. Okay.
Okay.
So here I'm in the right upper lobe. Deep breath. The left upper lobe. The right middle lobe. Normally I would do this with no clothing on, so I could hear this a lot better. You can lift your breath here. This would be the left lower lobe. Right here would be the right lower lobe. Cross your arms, Megan. Here is the right lateral lobe. I'm gonna go on the other side, cross your other arm. And the left lower lobe. I'm also gonna look at the back. Here is her right upper lobe, her left upper lobe. Take a deep breath in. Left lower lobe, right lower lobe. Your breaths are good, Megan?
Okay.
I said that you were about a 70 on the pulse.
Mhm.
I wanna make sure I check your breathing.
Okay.
We're gonna do kind of assessment again. Just take deep breaths like normal.
Okay.
Go ahead and breathe in. All right, you're good. You're about 14 breaths, and that's in normal range.
Okay.
Have you had any coughs with this allergy season? Are you having any coughs or anything?
No.
Okay, that's good. But in case you do, I want to give you some techniques that you can use in case you start developing a cough from drainage or anything like that. So what you want to do is you want to do a deep cough technique. You want to just hold your I want you to demonstrate this. So you just take a deep breath, go into your arm, and take a hard cough as deep as you can. Okay. So go ahead and do that. You can do this every 2 hours. It really clears out any kind of congestion that's starting to build in your chest, okay? Also, there's one that we would give you an incentive spirometer. This is one where you take a deep breath, you hold in, you blow, and you just blow until you can move the spacer up. And in this one, you want to do this like during, maybe just being calm, watching TV, just do this maybe 10 times per hour or 10 times while you're watching TV, okay? All right, so I'm gonna get you to demonstrate this for me.
Okay.
Remember, you take a deep breath and you blow. Good. And remember, you do that about 10 times per hour. Okay. All right, so we're moving past the respiratory and we're going to the cardio.
Okay.
Her lungs are good sounding. There's no, her breaths are smooth. They're in rhythm. She's not is unlabored and not shallow breaths, just regular smooth rhythm. Okay. Here I'm gonna check for your heart.
Okay.
All right, and so here is her second intercostal space here, right up under the clavicle, second intercostal space, right on the right side of her sternum. This is her aortic valve, pulmonary valve, Erb's point, tricuspid valve right on this side of the breast, mitral valve on this side of the breast. This is also an area that I would turn my stethoscope to the bell sound to listen for any murmurs or abnormal sound. Going back to the lungs, there was no adventitious sound, which means there's no abnormal sounds. The heart sounds good as well. Okay.
Okay.
Now, Megan, have you had any with your are you had any heaviness feeling on your when you breathe, or any difficulties breathing, anything that's rapid heartbeat? You feel like your heart's racing or anything like that?
No.
Okay, good deal. And you've had no shortness of breath or anything like that?
That's correct.
Okay. So now I'm gonna listen to your, we're moving right along, I'm gonna listen to your gastro.
Okay.
And so, yep, you can lean back. I'm gonna start down here in the right lower quadrant, just the way her bowels move. So we're gonna go right lower quadrant, the right upper quadrant, the left upper quadrant, and the lower quadrant. And I'm just gonna listen for a little while on each of those quadrants to be sure there's no sounds that that are abnormal. I would turn the bell of this if I wanted to get right here in the middle and listen for anything like brute or any other sounds that just normally I shouldn't hear there, okay? And I can hear that with this turn. Are you going to the making bowel movements regularly?
Yes.
How often are you going?
I go about 3 to 5 times a day.
Oh, that's great. I wish I could do that. But that's good. You must be drinking plenty of fluids, so
Yes.
that's really good. And also, are you having any pain or anything?
No.
When you're not going to constipation, it's not loose bowels, right?
No.
Okay, good. Also, are you finding yourself passing gas a lot?
I'm pretty gassy.
Okay. And we're gonna check for a couple things here on your arms. I kinda wanna do this together because I tend to forget it if I don't.
Okay.
I'm checking for your motor movements now and just seeing how you do. This would be in a position that I would say would be an extension, but I also want you to bring it up like you're flexing your muscle, okay?
Okay.
Now I would do this on both sides, and so you wanna extend and flex. Okay, there's no crepitus in her elbow joint here that I'm holding. She has good range of motion, strong I would say she's muscle strength. I'm gonna check this now. Go ahead and push back against me. Good. Push forward. Good. Very good. I would do this on both sides. Her muscle strength is good. Also, one of the things I missed before is her pulse strength. When I was checking her pulses on her radio, she was at like a 2+, so her pulses were strong. Also, I would check, but going back to cardio, is her capillary refill, and making sure that her refill is no more than 2 to 3 seconds on her capillary refill. So she looks good there both ways. Megan, I'm gonna do one more upper extremity. I want you to just what we call supination and pronation. So you're holding your arms up. Good. Good. And now this is supination. Now go back to the turn your arms down now. Okay. So good range of motion there. That's good. And her strength is good. She's able to do both range of motions there. All right. So now I'm gonna check your legs, Megan, and we could just keep sitting here. You can take that off and let me check in a few more pulses. And then we're gonna do some walking. And then you should be good to go, okay? So here I just want you to just bend it normal. This is an extended position. And I want you to move your leg, what we call out. We want you to flex it, okay? So good, I don't feel any crepitus or anything. Let me try the other side. Good. Here, your foot is in what I call just relax it. You relax your foot. Your foot is in the extend position right now. I want you to flex it by pressing it down. Good, and bring it back up to hyperextension. Okay, you do the other side too. Regular extension. I know it's kind of weird, but I want you to, yeah, you're flexing and you're doing good there. And bring it back up to hyperextension. Okay, so her ankle doesn't show any crepitus and she's doing well there. There are a couple pulses that I would check here. That would be the femoral pulse here, way up here. Also, she has a pulse, popliteal pulse behind her knee. She has a posterior pulse here that I would check. Dorsalis pedis pulse right above her foot. I'm also checking the capillary refill on her toes to make sure that it's no more than 2 or 3 seconds. I'm also checking for edema here in the legs. You haven't had any swelling?
No, not in this leg.
Any pain that you're feeling when I asked you to move those muscles?
No, not today.
Relaxing. Do you have it sometimes?
Sometimes.
When do you notice it most?
When I'm on my feet a lot.
Good, yeah, that makes sense. I'm also checking for swelling and edema in the arms. Do you ever find your arms pretty swollen or hands?
No.
Okay, good. All right. Looks good.
Okay.
All right, so Megan, I'm gonna ask you to do a walk here.
Okay.
And I want you to just walk, and I want you to just put your feet right in front of the other, just normal, but put your feet like, kind of like a model walk. Good, you can turn back around. You look good there. All right. I'm also gonna check for the Rombuck test, and so what we're doing here is I'm just checking your balance. So I want you to close your eyes and put my hands right here. I'm gonna let go and just see what you do. Oh, and you're pretty still. You're not swaying at all, so that's a good job. How often are you using, now I asked you about your bowels, but how often are you using the bathroom when you pee? You said quite a few times a day?
Yeah, I try to drink at least 16 fluid ounces a day. Really don't get that much, so I try, I probably maybe twice every 3 hours or so.
Okay, that's pretty good. You know, you want to be peeing regularly, like when you drink, you want it to be half your body weight, okay? So in ounces. So if you can just measure, typically if you measure your body weight, put it in half, and you drink that many ounces. A bottle of water is about 16 ounces, 16.9 ounces. So if you multiply that, you can figure out how many bottles you need a day. And you want to stick with that, okay?
Okay.
All right. Do you have any questions for me, Megan?
I don't think so, Ms. Green.
All right, well, I hope I've covered everything. I don't think I missed anything today. But if I did, trust me, the doctor will get to me and ask me about it, and I'll ask you about it.
Okay.
All right, so thank you so much.
Thank
Have a
you.
good rest of your day.
You
I'll let
too.
them know what we found.
Yes.
Okay,
Thank
bye-bye.
you.